Nearly 2,000 people are hospitalized with the virus in Alabama right now, a new daily high in the state. The new record comes before another expected increase in cases in the weeks following Thanksgiving. Dr. Rendi Murphree with the Mobile County Health Department is joining us live. Thank you for being here. Dr. Murphree, how much have the numbers increased and how concerning is this to you?
Yeah, they've gone up quite a bit over the past couple of weeks. We've just seen a steady rise in the number of cases. Right after Halloween, we saw an increase of cases, then it dropped down a little bit, and now we're starting to see the fallout of gatherings around Thanksgiving. Yesterday, 163 cases were reported in Mobile County residents, and that is a really high number, the likes we haven't seen in many, many weeks.
Would the numbers already be in from Thanksgiving gatherings, or would that take a few more days?
It'll take some time because if you are exposed, most people will be symptomatic or test positive within 2 to 14 days after their exposure. Most people in the first week or so. So we will continue to see infections due to gatherings over the Thanksgiving holiday for another probably 10 or 12 days.
Unfortunately. Dr. Murphree, do you think anything should be done differently within the city of Mobile or within the state of Alabama to stop the spread?
Well, you know, our current safer at home order that requires face coverings when you're outside, is in effect through December 11th, and we are expecting and hoping that the governor will extend that order another month or longer sometime next week, because the things that we have been doing that slowed the spread in late summer will continue to work if we adhere to those. We still have to adhere to physical distancing, no gatherings where you can't maintain 6 feet of distance between people who don't live together, wearing face coverings when that distance can't be maintained or when you're outside, and then the other things, washing your hands. But what we also have to remember is to try to reduce our attendance to gatherings and reduce the size of gatherings, because that's what we're really seeing excel or cause the acceleration in our COVID transmission.
There have been mentions of a nationwide shutdown. Do you think that would solve the problem?
Well, it would definitely help, but that's not realistic in these day and times. You know, we did that early on. The entire nation, many states had total shutdowns, including Alabama, and that worked to slow the spread and flatten the curve while our, scientists and healthcare professionals work toward therapeutics and vaccinations. And so it's unlikely this late in the game that there will be a total nationwide shutdown, but it would definitely help. So that's why we're encouraging people, if you follow the guidelines and if you reduce your attendance at gatherings and reduce the size of gatherings, then hopefully we can slow the spread now until the vaccine is available. All of these measures were to mitigate the outbreak, to slow the spread, to give our scientists and our healthcare professionals time to develop preventive therapeutics and treatments.
I feel like we're seeing more children with the virus. Is that the case, or what's going on here?
Now, we are seeing a lot more children, school-aged kids, young adults with COVID-19. Of course, this summer when there was no school, they had, they stayed at home. They weren't gathering with friends in classrooms or in cafeterias or on the playground. And after school started back, then we started seeing cases pick up in children, in youth, and in college-aged kids. And I suspect that when school is out over the holidays, we will see a reduction in cases among children. And then as on-site instruction, in-person learning begins again in January, we will expect for that to start to rise again. Sure. And it's not just being in school. I mean, people are gathering outside of school. There are after-school sports, there are after-school activities. People who go to school together generally then congregate together in the evenings or on weekends, and those are the kinds of things that we're asking people to avoid to the greatest extent possible to try to slow the spread in kids.
So again, just everyone, just try to avoid those large gatherings. Hygiene, simply just washing your hands and wearing masks.
That's right. Yeah, and keeping that 6 foot of physical distance. Those are the things that it's going to take to slow the spread, because we're seeing counts of cases and the number of people hospitalized with COVID, the likes that we haven't seen since July when we had our first peak. So we actually are concerned about what the pandemic is going to look like in Mobile over the coming weeks and months.
Yeah, and every right to be concerned. Dr. Rendi Murphree, thank you so much for joining us.